everyone. Welcome to Coaching for Change. My name is Jennifer Smith, and I'm an outreach professional here with CoCares. We are the Colorado Alliance for Resilient and Equitable Systems, and we serve the healthcare and public health workforce. Today, we're going to be going over the Professional Quality of Life Measuring Tool, also called ProQOL, and the manual review. This was created by the Center for Victims of Torture. So the reason we're doing these videos, we want to support the Colorado healthcare and public health workforce. We want to increase awareness of resources. We want to explain the resources and just present the best free resources we can to everyone in this easy to view format. We understand there's a lot of free resources available online for healthcare workers and public health, but it's hard to find them, locate them, disseminate them, what tools are going to work for you, which ones are not. So we want to bring them here, just ones that we have found through our research, and just explain them and see if that's something you want to use in the future. So the ProQOL measuring tool and manual, they are definitely, it's one of the two surveys on like burnout and compassion fatigue and things like that that we've found. The other one was the NIOSH Worker Wellbeing Survey. And so this one was developed to monitor the well-being of healthcare and public health workers and the possible impacts of their work on their well-being. So the tool measures perceived support, compassion satisfaction, burnout, secondary traumatic stress, moral distress, compassion fatigue. And the tool has two components: the questionnaire, which is the tool itself, and then the manual, which gives guidance on the tool, the concepts, the definitions, and follow-up care. The Centers for the Victims of Torture states individuals may use this tool for themselves and administration, to employees, to teams, to facilities and organizations. Management may also use this tool for the employees. So you can use this as much as you would like, and they do recommend taking the survey on a quarterly basis so that you can monitor progress, of any changes, or just keep an eye, I think, on your teams and how they're doing as far as burnout and things like that. We recommend reviewing the manual before filling out the questionnaire or tool, just so you understand again how to use it, the concepts, and all their definitions. This is a screenshot of the questionnaire. So you can see that it's pretty easy to fill out. Again, it just goes down the line with all of these questions, and you can answer 1 being never, 2 rarely, 3 sometimes, 4 often, and 5 very often. And then of course they have at the end and in the manual how you're going to score and tally up the results. Now, some of their definitions, I like the way they break things down into certain categories, depending on what you're taking this for, what's going on with your team. So they say compassion satisfaction is more of the positive aspects of working as a helper. And then compassion fatigue is the negative aspects of working as a helper. So I kind of like how they break those two apart there, because we can have satisfaction in that as well, but also it can cause fatigue. Burnout, which is inefficacy and feeling overwhelmed. And then they do talk about work-related traumatic stress, primary traumatic stress as the direct target of an event. And then there's secondary traumatic exposure to event due to a relationship with the primary person. So they discuss compassion satisfaction. So it's the positive aspects of helping. You can get pleasure and satisfaction when you work helping and caregiving. So when you work as a nurse, you work as a CNA, a caregiver in somebody's home, any of these titles where you're helping people or working in a system that helps people as well. It can be related to providing care, colleagues, work relationships, altruism, where you have concern for the welfare and or happiness of other human beings or animals. And then compassion fatigue, the negative aspects of helping, can be related to, again, providing care, the system, work with colleagues, beliefs about self. And then they talk about burnout and secondary traumatic stress. Burnout is work-related hopelessness and feelings of inefficacy. Then you have secondary traumatic stress, which they say is work-related secondary exposure to extremely or traumatically stressful events. Both share negative effects. Burnout is about being worn out. Secondary traumatic stress is about being afraid. So here's some information on the ProQOL survey in the manual. The ProQOL survey is a 30-item self-report measure of the positive and negative aspects of caring. The ProQOL measures compassion satisfaction and compassion fatigue. The ProQOL is the most widely used measure of the positive and negative aspects of helping in the world. It has been used for more than 15 years. The measure was developed with data from more than 3,000 people. It can be given individually or in groups. You can use the full scoring for more detail, or they also have a simplified scoring. So depending on how you want to use this. How they recommend using the ProQOL. So you can use it individually or personally. They say the ProQOL can help you plan where to put your energy to increase resilience. So if you're just looking personally as to maybe what's going on with you or what you should be focusing on, you can use it for organizational planning. It can help organizations find ways to maximize the positive aspects and reduce the negative aspects of helping. And you can use it for supportive supervision. The ProQOL can be used to inform discussions. So I think all of these are great ways to use the tool. An organization can use it for their planning. You can use it to support just a team. Maybe you're a team lead or you manage a small group of people, and that might be good if you're trying to find what resources to use or what to do next or what kind of information you should be giving out at meetings and huddles. This can help you gauge the direction where you need to go and where you need to put your focus for your team as well, and can open up some conversations and some changes that need to happen. So that is the ProQOL survey. So again, this is a really great tool, I think, to use to see where people are at as far as that burnout aspect and that compassion fatigue. What's going on, where can you get more information, which is on the proqol.org/proqol-measure, or you can just Google proqol.org or Google Professional Quality of Life Measuring Tool. They'll have all the information about the tool. You can download the tool itself, and then also the manual. The manual is really great to guide you through how to use this and how it can best help your team. But I think the surveys are a really great way to help because they help gauge where you need to focus. So if you're trying to think of what you can do to help your team, a good start is doing one of the surveys to see where people are at as far as their burnout and their resilience. So thank you so much for watching. We hope that you enjoyed the video. We hope the tool can help you, and we'll put out more videos for Coaching for Change soon. You can contact us at co-cares.org, and we hope you have a great day. Thank you so much for watching.